Have you ever been in a meeting, stuck in traffic, or watching a movie and thought to yourself, I can hold it just a little longer? Maybe you were too busy at work, or the public restroom seemed too dirty, or you simply didn't want to interrupt what you were doing. It seems like such a small thing, such an insignificant decision, but what if I told you that this simple habit of holding your urine could be silently destroying your urinary system and opening the door to infections that could become chronic and affect your quality of life forever? The truth is that millions of people around the world are suffering from recurrent urinary tract infections without understanding that the root cause might be hiding in this daily habit that seems so harmless. I'm talking about something that affects teachers who can't leave the classroom, truck drivers on long routes, office workers in endless meetings, and even parents who put their children's needs before their own bodily functions. If you've ever felt that burning sensation when urinating, that constant urgency to go to the bathroom even when nothing comes out, or that deep pain in your lower abdomen that makes you want to curl up in bed, you know exactly what I'm talking about. And the worst part is that you probably never imagined that the cause could be something as simple as holding your pee for too long. If you've ever woken up in the middle of the night feeling that burning sensation when urinating, or if you've had to cancel plans because of an infection that seemed endless, you're in the right place. Before we continue, click the subscribe button and activate the bell notification. This way, you'll become part of our intimate health community, where we share real solutions that doctors rarely mention. Each video is like a detailed consultation, but in the comfort of your home. Subscribe now and begin your journey to a life without the discomfort of urinary tract infections. Today, I'm going to reveal 5 critical truths about what happens to your body when you hold your urine and how this directly connects to urinary tract infections that could be ruining your life right now. These aren't just medical theories or assumptions. These are facts backed by years of research, real cases from patients I've seen suffer unnecessarily, and information that could literally save you from years of pain and discomfort. By the end of this video, you'll understand exactly why that habit of holding your pee is so dangerous, what's really happening inside your bladder at this very moment, and most importantly, what you can do starting today to reverse the damage and protect yourself from future infections. Starting with number 5, when you hold your pee, you are literally creating a perfect breeding ground for bacteria inside your bladder. Think of your bladder as a balloon that fills with liquid, but unlike a simple balloon, your bladder is lined with a delicate mucous membrane designed to be in constant contact with fresh flowing urine. When urine stays stagnant in your bladder for extended periods, something called urinary stasis occurs, which is basically a fancy medical term for saying that your urine is just sitting there, not moving, becoming warmer and more concentrated. Bacteria, especially Escherichia coli, which is responsible for about 80 to 90% of all urinary tract infections, absolutely love this environment. These microscopic organisms need 3 things to thrive: warmth, moisture, and time. And when you hold your pee, you're giving them all 3 on a silver platter. Let me tell you about Rebecca, a 34-year-old elementary school teacher from Portland who came to see me after suffering from her 7th urinary tract infection in just 2 years. Rebecca was desperate, and honestly starting to feel like her body was betraying her. She told me that she had tried everything, every antibiotic her doctor prescribed, drinking cranberry juice by the gallon, taking probiotics, and even changing her entire diet. But nothing seemed to work. When I sat down with Rebecca and started asking about her daily routine, something jumped out immediately. As a teacher, she couldn't just leave her classroom whenever she needed to use the bathroom. She had 28 young students who needed supervision, and bathroom breaks were scheduled at specific times. So Rebecca had gotten into the habit of holding her urine from the moment she arrived at school at 7:30 in the morning until her lunch break at noon, sometimes even longer. That's 4.5 to 6 hours of holding urine consistently, 5 days a week. What Rebecca didn't understand is that every time she held her urine for those extended periods, she was allowing bacteria to multiply exponentially in her bladder. Research published in the Journal of Clinical Microbiology has shown that bacteria like E. coli can double their population every 20 minutes under ideal conditions, and a warm, stagnant bladder full of nutrient-rich urine is pretty much bacterial paradise. So if Rebecca started her day with even a small amount of bacteria in her bladder, By the time she finally made it to the bathroom 4 or 5 hours later, those few bacteria could have multiplied into millions. The bladder's natural defense mechanism is to flush out bacteria through regular urination, but when you hold your pee, you're essentially shutting down your body's primary defense system. After I explained this to Rebecca, and we made some changes to her routine, including getting a classroom aide to cover for her during bathroom breaks and setting phone reminders to urinate every 2 to 3 hours, even on weekends, her infections stopped. She's now been infection-free for over 18 months. Moving on to number 4, when you chronically hold your urine, you're actually stretching and weakening the bladder muscle, which is called the detrusor muscle. This muscle is responsible for contracting and completely emptying your bladder when you urinate. Think of it like any other muscle in your body. If you overstretch a rubber band repeatedly, eventually it loses its elasticity and can't snap back to its original shape. The same thing happens with your bladder muscle. When you consistently overfill your bladder beyond its comfortable capacity, the muscle fibers stretch, and over time they lose their ability to contract effectively. This leads to a condition called incomplete bladder emptying, which is exactly what it sounds like. Even when you finally do go to the bathroom, your bladder can't fully empty itself, leaving behind residual urine that becomes another perfect environment for bacteria to grow. Let me share the story of Michael, a 42-year-old long-haul truck driver from Texas, who was experiencing what he called the most embarrassing and painful period of his life. Michael's job required him to drive for hours at a time, sometimes 6 to 8 hours between rest stops, and he had trained himself over the years to hold his urine for incredibly long periods. But then the infections started, and they became so frequent that he was missing work and losing income. What made Michael's case particularly interesting was that even after he took antibiotics and the infection seemed to clear up, urine tests would still show small amounts of bacteria present. After a series of tests, including a post-void residual test, which measures how much urine is left in the bladder after urination, we discovered that Michael was retaining almost 4 ounces of urine in his bladder every single time he went to the bathroom. That's a quarter of his total bladder capacity, just sitting there, stagnant, providing a constant reservoir for bacteria to hide and multiply. Michael's bladder muscle had been so overstretched for so many years that it had essentially become lazy and weak, unable to generate enough force to completely empty itself. Studies from the International Urogynecology Journal have shown that people who regularly hold their urine for more than 4 hours at a time have a significantly higher risk of developing chronic urinary retention and recurrent infections. For Michael, the solution involved not just treating the infections with antibiotics, but also retraining his bladder muscle through pelvic floor exercises, timed voiding schedules, and working with his employer to ensure he had more frequent rest stop opportunities. It took about 4 months of consistent work, but Michael's bladder function improved dramatically, and his infections finally stopped recurring. Now we're at number 3, and this is where things get really dangerous, because we're going to talk about something called vesicoureteral reflux. Your urinary system is designed as a one-way street. Urine is supposed to flow from your kidneys down through tubes called ureters into your bladder, and then out through your urethra. When you urinate, at the point where each ureter connects to your bladder, there's a special valve mechanism that prevents urine from flowing backward from the bladder up into the ureters and potentially reaching your kidneys. But when you overfill your bladder by holding your urine for too long, the pressure inside your bladder increases dramatically, and this increased pressure can actually overcome that valve mechanism, forcing urine and any bacteria it contains to flow backward up into your ureters and towards your kidneys. This is incredibly dangerous because a kidney infection, which is called pyelonephritis, is far more serious than a simple bladder infection. Kidney infections can cause permanent kidney damage, lead to sepsis, which is a life-threatening bloodstream infection, and in severe cases can even be fatal. The symptoms include high fever, severe back or side pain, nausea, vomiting, and feeling extremely ill. Let me tell you about Jennifer, a 29-year-old marketing executive from Chicago who learned this lesson the hard way. Jennifer would often work through lunch, skip bathroom breaks to finish presentations, and hold her urine for 5 or 6 hours at a time without thinking twice about it. She had experienced a few bladder infections over the years, nothing too serious, But then one Friday afternoon, everything changed. Jennifer started feeling a dull ache in her lower back, and by that evening, the ache had become severe pain on her right side, and she developed a fever of 103 degrees. Her boyfriend rushed her to the emergency room, where tests revealed that she had a severe kidney infection with bacteria that had traveled all the way up from her bladder. The emergency room doctor explained that she had developed acute pyelonephritis, and the infection was so severe that she needed to be admitted to the hospital for intravenous antibiotics. Jennifer spent 4 days in the hospital and experienced pain that she described as worse than anything she had ever felt in her life. But the worst part came later, when follow-up tests revealed that the infection had caused some scarring in her right kidney, potentially affecting its function long-term. All of this could have been prevented if Jennifer had simply listened to her body's signals and emptied her bladder regularly, instead of holding her urine for extended periods. Research published in the American Journal of Kidney Diseases has shown that people who habitually hold their urine have up to a 40% higher risk of developing upper urinary tract infections, including kidney infections, compared to those who urinate regularly every 2 to 3 hours. Let's pause for a moment. I want to ask you something personal. How many times have you felt that urgency to urinate, but convinced yourself to wait just a little longer because you were too busy, too uncomfortable with public restrooms, or simply too absorbed in what you were doing? How many times have you ignored your body's clear signals because you thought you knew better? It's as if we've been trained to override our most basic bodily functions in favor of productivity or convenience, isn't it? If you identified with what I'm saying, I want to invite you to share your experience in the comments. It can be something simple like, I've been holding my pee at work for years and never knew it could cause infections. Your comment might seem small to you, but for someone reading it, feeling the same pressure to ignore their body's signals, it could be exactly the wake-up call that person needs to make a change. Comment now, while this realization is fresh, and let's together acknowledge that our health is more important than any meeting or deadline. Now, number 2, and this affects women in particular. When you hold your urine, you're creating changes in the pH balance and the natural bacterial flora of your entire urinary tract. Your urine normally has a slightly acidic pH, usually between 4.5 and 8 on the pH scale, and this acidity is actually one of your body's natural defense mechanisms against infection. Many harmful bacteria prefer a more neutral or slightly alkaline environment. The acidity of normal, fresh urine helps keep these bacteria in check. But when you hold your urine for extended periods, the urine becomes more concentrated and the pH balance shifts. If any bacteria are present, they begin producing waste products that can change the pH of the urine, making it less acidic and more hospitable to bacterial growth. The bladder lining itself can become irritated from prolonged contact with concentrated urine, leading to microscopic damage that makes it easier for bacteria to attach. Let me tell you about Sarah, a 38-year-old mother of 3 from Denver, who came to see me after suffering from symptoms of a urinary tract infection for almost 8 weeks straight, despite taking 3 different courses of antibiotics. Sarah was exhausted and starting to worry that something was seriously wrong. When I took her history, a pattern emerged. Sarah was a stay-at-home mom with 3 children under the age of 7. Her days were completely consumed with caring for her kids, and the idea of taking a bathroom break whenever she needed one was almost laughable. She would hold her urine for hours, sometimes from the moment she woke up until after she put the kids down for their afternoon naps. She was also chronically dehydrated because she figured if she didn't drink much, she wouldn't need to pee as often. This combination of holding urine and being dehydrated was wreaking havoc on Sarah's urinary system. The concentrated urine was irritating her bladder lining, creating tiny areas of inflammation where bacteria could take hold. The lack of regular flushing meant bacteria had plenty of time to multiply and form what's called a biofilm, which is a protective coating that bacteria create that makes them much harder for antibiotics to kill. The treatment for Sarah involved multiple approaches. First, we had to address the immediate infection with a longer course of antibiotics. Second, we had to change her daily habits. I worked with her to develop a realistic schedule where she would drink at least 8 glasses of water throughout the day and take regular bathroom breaks every 2 to 3 hours. Third, we added a supplement called D-Minose, which helps prevent E. coli bacteria from sticking to the bladder wall. It took about 3 months, but Sarah finally became symptom-free. And most importantly, she learned that taking care of her own basic needs wasn't selfish. It was absolutely necessary for her health. And now, number 1, the most critical truth that most doctors will never tell you. When you chronically hold your urine, you are actually teaching your bladder to ignore its own nerve signals, creating a condition called sensory dysfunction of the bladder. This is perhaps the most insidious consequence because it creates a vicious cycle that becomes harder and harder to break. Your bladder has specialized nerve endings called stretch receptors that send signals to your brain when your bladder is filling up. These signals start out gentle, giving you plenty of advance notice. But if you ignore these signals repeatedly, your brain and bladder start to recalibrate. Your body essentially says, okay, if you're not going to respond to these gentle signals, I'll stop sending them so often. This is why people who chronically hold their urine often report that they go from feeling no urge at all to suddenly feeling a desperate, painful urgency with very little warning. Let me introduce you to David, a 56-year-old accountant from Boston who had been suffering from recurrent urinary tract infections for almost 3 years. David had seen multiple doctors, tried numerous antibiotics, and even underwent invasive tests. Everything came back normal, yet David continued to get UTIs every few months. When I really dug into his history, a picture emerged. David had worked in accounting for over 30 years, often during tax season working 12 to 14-hour days at his desk. He had developed the habit of holding his urine for extremely long periods, sometimes 6 to 8 hours at a stretch. Over the years, David noticed that he rarely felt the need to urinate unless his bladder was absolutely full, and he actually thought this was a good thing. What David didn't realize was that he had essentially damaged the nerve signaling in his bladder through decades of ignoring his body's signals. The treatment for David was challenging because we weren't just treating an infection, we were trying to retrain his bladder after decades of dysfunction. We started with a timed voiding schedule where David had to urinate every 2 hours during the day, whether he felt the urge or not. We also used bladder retraining techniques and pelvic floors. Physical therapy. It took almost a year, but David's bladder function gradually improved. He started to feel more normal urges to urinate, his bladder capacity normalized, and most importantly, his infections stopped. David has now been infection-free for over 2 years. Research from the Journal of Urology has shown that sensory dysfunction of the bladder affects an estimated 20 to 30% of adults who have a history of holding their urine regularly over many years. The good news is that with proper retraining and behavioral changes, most people can improve their bladder function significantly. So what should you do with all this information? First, and most importantly, stop holding your pee. Set a timer on your phone if you need to, reminding yourself to take a bathroom break every 2 to 3 hours. Second, stay properly hydrated. Drink at least 8 glasses of water throughout the day. Proper hydration helps protect your urinary system by keeping urine diluted and flowing regularly. Third, practice good bathroom habits. When you urinate, take your time and make sure your bladder is completely empty. Fourth, if you experience recurrent urinary tract infections, talk to your doctor about the connection between holding your urine and your infections. Ask about bladder retraining programs and pelvic floor physical therapy. Fifth, pay attention to your body's signals. If you feel any burning with urination, increased frequency or urgency, or pelvic pain, don't wait. Your body is not your enemy. When your bladder sends you that signal that it's time to urinate, it's not being inconvenient, it's protecting you. It's trying to prevent infections, maintain proper muscle tone, protect your kidneys, and keep your entire urinary system functioning optimally. The modern world has taught us to ignore our body's signals, to push through discomfort, to prioritize productivity over basic biological needs. But this approach is backfiring, leading to chronic health. Problems that could be prevented with something as simple as listening to our bodies and taking regular bathroom breaks. You deserve to live without the constant pain and disruption of urinary tract infections. If this video helped you better understand what's happening with your body, imagine what the next ones can do for your health. Subscribe to the channel right now and join thousands of people who have already transformed their relationship with intimate health. Here you'll find more than just medical information. You'll find understanding, practical solutions, and a community that knows exactly what you're going through. Click subscribe, activate notifications, and together, let's build a life with less pain and more well-being. Your health deserves this attention.